Well, today is International Nurses Day. Nurses have been described as the cornerstone of the healthcare system. The day is also in remembrance of the birthday of the founder of modern-day nursing, Florence Nightingale. For more on this, let's now speak to Howard Catton, CEO of the International Council of Nurses. Howard, a very good afternoon to you, and thank you so much for your time. So, South Africa has a good and rich history of producing some of the best nurses globally. As many mark Nurses Day under the backdrop of systemic challenges in this country, let's talk internationally. How would you characterize the nursing profession just over the years, particularly when you look at it from a global perspective? But I want to then draw some inferences right here on the African continent.
So firstly, happy International Nurses Day to you, to everyone. There are about 30 million nurses globally. So I think probably everyone, almost everyone around the world will know a nurse. We have published a new report today with the World Health Organization, which gives us a sense of the health of the global nursing workforce. And there are some hugely concerning signs in that report. We have a shortage of about 5.8 million nurses around the world. We have not enough attention being paid to the health and well-being of nurses. About half of countries don't have basic policies in place for good employment. Nurses' pay is low. Nurses aren't being prevented from attacks, and their mental health isn't being supported. These are all things which are important to retain the nurses that we have, as well as to recruit new nurses into the profession. And this is also important, not just to do the right thing by nurses, but to address the big global health challenges that we have: aging populations, impacts of climate change, conflicts, infectious diseases, giving people access to healthcare. Nurses make up about half of health workforce right the way around the world, and we just can't deliver good global health without nurses.
And I mean, to what extent then does the shortage that you speak of, I think you said something around 4.8 million, globally, to what extent does that impact then on nurses being able to provide the kind of quality healthcare that many, countries, particularly here on the African continent, desperately need?
5.8 million is the shortage that we've announced today. But there's great variation, and the continent of Africa, whilst it's made some progress in hiring new nurses, educating more nurses, it's not enough to keep up with the demand that exists. Add to that shortage these issues of poor pay and working conditions, and it fuels the international migration and movement of nurses right the way around the world. A particular issue for Africa when we project forward is that because of growing health needs and growing populations, it could be that Africa has one of the biggest shares of shortage of nurses around the world. And this is why it needs urgent attention from all health ministers as well, because the impact is on people who can't access healthcare, have to wait a long time for healthcare, don't get the best, most up-to-date treatment that's available. And we know, you know the saying, health is wealth. Well, it's true. Health, good health, drives economic growth and prosperity. So investing in nursing is investing in health, but it's investing in the economies of our countries as well.
And just staying on that issue of, shortages, I mean, the ongoing shortages of healthcare professionals here in South Africa does play a major role, I mean, to the kind of quality healthcare that I spoke of, to millions of South Africans. The health department here in the country has announced plans to recruit 200 new nurses in the coming months or so to address the ongoing shortage. What are the negative effects of international nurse recruitment to your more developed, wealthier nations elsewhere in the world?
You're absolutely right to highlight this as an issue because it is, as you say, overwhelmingly high-income countries who are recruiting from middle and low-income countries. Those high-income countries already have more nurses per head of population, so they are depleting nurses from countries who are already in a weak and a vulnerable position. And we have done a lot of work from the International Council to highlight the very real health harms that exist from the aggressive and high levels of international recruitment that we're seeing at the moment. We think there are a couple of things here that need to be done. That high-income countries talk about ethical recruitment, not wanting to do harm, but we think that needs to translate into more tangible action. What are they actually giving to invest back into the countries that they're recruiting from? Because if they're taking without giving, then some might say that that is stealing. But that doesn't let off the hook the countries who are losing their nurses. Are they doing as much as they possibly can to ensure good working conditions, fair pay, that people feel valued and respected at work? There's the opportunity for career progression as well. Countries need to be investing to make nursing an attractive profession for future generations and holding on to the gold that is in their experienced nursing workforce.
Yeah, and Howard, as we wrap up our conversation, I want to end probably with just some of the problems you highlighted that are facing nurses, today. You mentioned aging population, you mentioned infections, etc. Is there synergy and alignment between the needs on the ground currently and the kind of training and teaching requirements of nurses? Or has there been some form of a shift, do you think?
We are seeing a growing gap between the demand for healthcare and the supply of nurses. But nurses hold a lot of the solutions that we need. On the continent of Africa, there are nurses who work in specialist and advanced roles who are absolutely critical to bringing access to healthcare to people. They're highly trusted, giving public health advice. Specialist nurses for things like cancer or diabetes or long-term conditions. Nurses who focus on helping aging populations as well. So we shouldn't be thinking of nurses and nursing as just a big cost because there are so many of us. They're actually an investment in the healthcare, into population health. And there's an awful lot that is positive that we see from the continent of Africa. And we're asking governments, get behind those good practice examples, roll them out even more, see the potential for the solutions to some of these big problems in healthcare that we're facing now, see the potential for the solutions within the nursing profession.
Let me squeeze this one final question. As the International Council of Nurses, are you aware of just some of the safety concerns around nurses in South Africa? I mean, the health department here is calling for essentially all hands on deck, to protect nurses and healthcare workers. There's been an increase in incidents of violence, including assaults and robberies, particularly at primary health facilities in this country.
This hugely worrying issue about increase in violence and attacks on nurses and healthcare workers, yes, I hear of it from South Africa, but also around the world as well. And it is not just attacks and assaults from patients or the public, it can be from fellow healthcare workers as well. But what many of the nurses say to me is that you imagine a patient or their family who they're unwell, they're worried, they're scared what's going to happen. They come to a healthcare facility, they have to wait, they can't access healthcare, there may not be the equipment or the drugs there. People's fear, their concern can escalate into violence and assaults. Now that, I'm not condoning that in any way, shape or form, that's wrong, but we have to go to the root causes of what is putting our healthcare workers at risk. And these risks for global health are heightened at the moment as a result of some of the political decisions to defund USA aid. The US would announced withdrawal from the World Health Organization. This is a time where we need healthcare to be strong in countries, but we need healthcare to be strong globally as well.
Howard, thank you so much for your time. Really do appreciate it. Howard Catton is the CEO of the International Council of Nurses.